January 6th, 2025, Grafton Board of Health meeting. As a preliminary matter, this is Jen Maynard, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Karen Gwiazdowski-Govin.
Karen Gwiazdowski-Govin here.
Bill Mueller.
Bill Mueller here.
Thank you. Staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Nancy Connors.
Nancy Connors here.
Amelia Houghton.
Amelia Houghton here.
Molly Scannell.
Molly Scannell here.
Yvonne Thornton.
Yvonne Thornton here.
Cherry Tangri.
Cherry Tangri here.
Maddie Castile.
Castile here.
I think that's everybody. I'd like to open the meeting. Can I get a motion to open the meeting?
This is Bill Mueller. I make a motion that we open the meeting.
This is Karen Gwiazdowski-Govin. I second that motion.
Favor?
Bill Mueller, aye.
Karen Gwiazdowski-Govin, aye.
Jen Maynard, aye. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending criteria certain COVID-19 measures adopted during the state of emergency. This act includes an extension until March 31st, 2025 of the remote meeting provisions of former Governor Baker's March 12, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted at the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. If the public has a question or comment on an agenda item, please utilize the Q&A feature in Zoom. Please include your full name and address when submitting a comment. For this meeting, Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that to take care not to screen share your computer. Anything you broadcast may be captured by the recording. Any supporting materials that have been provided to members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first item on the agenda, permit me to cover some ground rules for effective and clear conduct of our business and ensure accurate meeting minutes. I'll introduce any speakers on the agenda for a topic. After they conclude their remarks, I'll invite the board members to provide any comment, questions, or motions. Please identify yourself by name when speaking. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until I yield the floor to you and state your name before speaking. If members wish to engage with other members, please do so through me, taking care to identify yourself. Finally, any votes and motions made during this meeting will be conducted by roll call vote. Okay. All right. First up on our agenda, our newest board member, Yvonne, is not going to be able to join us, and we do believe she may have conflicts moving forward. Once we confirm that there may be a new posting for a seat on the board. But we thank you for her trying to join our team here. We know that other commitments do come up, but we look forward to a new board member soon. Let's see, the Alliance update. I will pass it over to Amelia to tell us who should report off first.
So, hi, Amelia Houghton here. I would like to have Molly report out the nursing updates first. Thank you.
Hello, everyone. It's Molly. So COVID numbers remain steady at the moment. We had 13 reported cases for Grafton for the month of December, which is a slight increase from the 8 that we had in November. The BioBot analysis wastewater summary reflects a current rise in results, which is expected for this time of year for respiratory season. We had no reported cases of pertussis for December, which is good news for the schools. To prevent respiratory illness, masking, practicing hand hygiene, and vaccination according to your provider's recommendations is still the best protection. Getting the 24-25 COVID vaccine is important because the vaccine's efficacy decreases over time, and the updated COVID vaccine protects against the currently circulating strains. Getting a COVID vaccine is safer and more reliable to build protection than getting sick with COVID. DA presentations for seniors at the Grafton Senior Center is coming up in the spring. I mentioned it last meeting as well. The first topic will be scams targeting seniors. This is being planned for April 15th, 2025 at 10:30 a.m. And the flyer was sent to Nancy and Shannon at the Senior Center for posting already by Amelia. This will be a standing presentation for Grafton every 6 months with a new relevant topic. We are in the process of planning a follow-up round 2 shingles and RSV vaccine clinic for late January or early February. The date is still to be determined. As I mentioned last time, shingles, it's a 2-part vaccine. So this is an opportunity for those vaccinated September 27th at the Municipal Center gym to get that round 2 vaccine for shingles. The nursing department is currently interviewing for the regional public health position, and hopefully that role will be filled this month. Blood pressure clinics continue every other week at the Grafton Senior Center. The one on December 5th was canceled due to inclement weather, but the clinic held on the 19th, I saw 16 patients. And I have a lot for neurovirus. Cases of neurovirus are on the rise this year, with more than 90 outbreaks reported nationally the first week of December. Neurovirus is the leading cause of foodborne illness in the US. According to the CDC, it is responsible for 19 million to 21 million illnesses every year. It results in over 2.2 million outpatient medical visits, 465,000 emergency department visits, and 109,000 hospital admissions. It causes bouts of diarrhea and vomiting and is sometimes called Norwalk virus, the stomach bug, or the winter vomiting bug. Neurovirus is extremely contagious and causes outbreaks in schools, daycare centers, jails, anywhere where people are in close proximity with each other. And it is the cause of 90% of diarrheal illnesses on cruise ships. Outbreaks are common throughout the year, but tend to be more prevalent November to April. Neurovirus can be spread through direct contact, like sharing food, drinks, or food utensils with an infected person, or through contaminated surfaces, like touching a surface that an infected person touched and then touching your mouth. Some studies have shown that neurovirus can be transmitted up to 2 weeks after a person feels better. So that's a little shocking. Everyone should regularly wash their hands well with soap and water, especially before eating and after using the bathroom. Infected surfaces can be cleaned with solutions containing bleach to kill the virus. It's suggested not to drink raw milk or eat unpasteurized cheeses, raw or undercooked meats. Use an internal thermometer and make sure that what is being cooked reaches the recommended temperature. Don't eat perishable food that has been left out for more than 2 hours, and be sure to wash vegetables and fruits well and keep them separated from raw meat. Everyone preparing or serving food should wash their hands well, and people having gastrointestinal symptoms like vomiting, diarrhea, stomach aches, should not be preparing food at all or handling food-related utensils. Those in food handling fields should remain out of work for 72 hours after diarrhea resolves. And something to keep in mind, hand sanitizer doesn't kill the norovirus. The alcohol in it doesn't kill the virus. So hand washing is the best prevention method, as well as using bleach-based detergents. If everyone practices good hand hygiene with frequent hand washing and using hand sanitizer when running water isn't accessible, we could reduce the chance of contracting and spreading norovirus and other gastrointestinal illnesses for the season. Avian influenza or bird flu infections are currently affecting the poultry and dairy cow industry across the US, and sporadic human cases who are exposed to either infected dairy cows or infected poultry. In 2024, 8 states have reported cases. The virus generally causes mild illness, mostly conjunctivitis for a short period of time, in humans, and can be contracted through mouth, eyes, and nose. In severe cases, shortness of breath, pneumonia, and severe respiratory disease have been reported. Massachusetts reported depopulation and disposal of a couple of backyard flocks. This is from Essex County and Barnstable counties that were infected with the virus. But to date, no human cases have been reported in Massachusetts. The virus has only spread from animals to humans at this point, but the concern is if it begins to spread from human to human. Occupational exposure would require the use of highly protective PPE, and the CDC is looking into how accessible and effective that would be should cases rise. Authorities are monitoring the situation for the risk to public health, which at this time remains low. Human metaneurovirus, or MPPV, is a respiratory virus that causes symptoms similar to the common cold and influenza. While the illness is typically mild, it can lead to severe complications such as pneumonia and bronchitis, particularly in infants, the elderly, and the immunosuppressed. The virus is not new, but has gained attention amid a surge in cases, particularly in children under 14 in northern China and neighboring provinces. China is now experiencing a surge in infections of this respiratory virus, leading to public concerns about an outbreak. The CDC is monitoring the situation. The international outbreak of Marburg virus that I mentioned last meeting, that started in September 2024, has been declared over by the Ministry of Health of Rwanda, as per the World Health Organization recommendations. No new confirmed cases were reported since the last PCR test was conducted on November 7th and resulted negative for this last ill person. So that one's over. Are there any questions?
Just make a comment.
Oh, yes, go ahead.
They just had their first death of the flu virus, the bird flu in
Oh,
my God.
Louisiana. Yeah,
Oh, Louisiana.
yeah.
I think I read about that. It was a backyard flock, right?
Exactly.
Yeah, the person had just chickens in his backyard and he contracted avian flu.
And weren't they the first one to get the human case?
Death of the human case.
Yeah. Just something to look out for.
Yeah. Okay, that'll do it for the nursing update.
I think one thing there's an awful lot of things going on, Molly, in your neck of the woods right now. I think just one thing to flag with all of those updates, in particular those with GI or stomach bugs, like you talked about, that the risk of dehydration is very high, especially children and older adults. So if you are experiencing anything like that, or you're caring for someone, Very, very important to try and stay hydrated because sometimes that can make things much worse. So and that's truly the case for anything when you're sick, but especially a stomach bug.
It can, and the dehydration happens fast.
Absolutely. It is. And norovirus is if you've ever or never had it, it's not pleasant.
Yeah.
Not at all. Let's see. Thank you, Molly.
Can I go next?
Go ahead, Jerry.
Sorry, I have to leave. I have a class to
Oh,
get to. Good evening, everybody. I'm Cherry Tangri, Shared Services Coordinator. I have a very small update. Grafton, this is from our business plan where we wanted to increase outreach and the presence of the alliance. So for that, within the business plan, there was a goal to do so, and under that, the activity was to conduct open houses in each of our alliance town. Back in November, we did an open house in the town of Shrewsbury, where we showcased all our offices, projects, and initiatives that are ongoing. And for that, we had a presentation running in the background, and we had posters, and each of our staff was all of our shared staff and regional staff were present. This open house is scheduled to happen on February 27th. It's a Thursday between 12 to 2 p.m. and lunch will be served. And this is right now open only to municipal employees for the town of Grafton. So it would be an opportunity for all of the departments within the municipality to come speak with us and learn about what public health initiatives are ongoing. And if they have any questions, they can always ask us then and there.
Any questions?
And I'll be sending out the official invitation. I think it would be coming through the town manager. So I'll be working internally with Dr. Castile on developing the communication, and then we'll be sending it out.
Thank you, Jerry.
Thank you.
All right. Who's next?
I think that would be me.
Do you mind, Devon, if Kyle jumps in to say hello and introduce himself?
Please, please.
I almost forgot that I ran into Kyle when I came to see you. I think I ran into Kyle, maybe not. But go ahead, please, Kyle.
Hello, sorry, I just wanted to jump on quick and introduce myself. I'm Kyle O'Connor. Hello, board. I just want to say hi. I'm the new tobacco inspector for the city of Worcester and alliance towns like Grafton. So the next time there's an issue, or whether it be a violation or an update to the regulations, or if the board wants some more education on what I do for the town in regards to tobacco, please feel free to let me know. And I'll see you at the open house that Cherry was just talking about as well.
Great. Welcome, Kyle.
Welcome.
We've been very well taken care of by Cherry, who used to hold your role. So I'm sure you'll do great taking good care of us.
Big shoes to fill, yeah, but he's been great.
And a lot of regulations, so.
Yeah.
Thank you. All right, Devon, thanks for your patience. Take it away.
Hello, everyone. Happy New Year. I'm Devon Thornton. I am the Environmental Health Coordinator for Grafton and West Boylston for the Alliance Towns. To begin with, we've from November, I guess November until the end of the year, well, to January, we've had 15 unannounced routine comprehensive food inspections, one inspection of a spa, Oasis Hot Tubs. We've had one Title V review the witnessing of 3 soil tests and 2 Title V component inspections and 4 general complaints. And if you have the list as far as the complaints and have any questions, be more than willing to answer any questions.
I don't have any questions, but any members of the board, any questions on the complaints or inspections?
No questions or comments from me. Thank you.
Okay, thank you, Devon.
All right, well, that's all I have to report.
Perfect, thank you. It looks like it was a busy month and a half or so. Just, peppered those in between the holidays. Thank you.
Yeah.
Busy time for the restaurants, I'm sure, but that's great. Let's see. Any updates? I know Ian's not with us today, but anyone have any updates on the opioid settlement funds?
This is Bill Muller. We continue to have monthly meetings. At our last meeting, we actually had 2 representatives from a local halfway house. Apparently, we have 2 functioning halfway houses in Grafton currently. And I think it was very informative in terms of what some of the issues are that they're dealing with on a regular basis. I do think we've made some progress in terms of collaborating with our other alliance towns, West Boylston and Shrewsbury. We've had representation of those towns at our last couple of meetings, and I think we're going to be reciprocating in terms of going to some of their meetings as well. But beyond that, we're still in a fact-finding and planning mode, and we haven't really spent much money. So,
Yeah, I think it will be good, Bill, to your point. I think we mentioned this last time when we found out about some resources that are here in town that we didn't know about necessarily.
sure.
To be able to get a better understanding of the towns in our, of course, statewide, but even in our surrounding communities, where these locations are, that's both for a support perspective, but also I think, support, awareness, and, making sure as well, just from an oversight perspective, knowing those things exist, I think is positive for us. So hopefully we can make some gains with that. Maddie, please.
I just wanted to know from William what were some of the things that you found out when you went to I call them sober homes. I don't know if that's what they were, or all kinds of names, but was it a sober home where somebody is actually, there is somebody there who monitors everybody? Yeah.
Yes. And I think actually, as I think is customarily the case, the staff are recovering substance abusers themselves, and much of their insight and much of their contribution to the effort is based upon what their own personal experiences were. I think one of our strategies is to not duplicate anything, and also to just get a sense of what sort of resources we have. One of our plans is actually to have someone recruited jointly by the 3 towns to be more of our coordinator for some of these efforts, but to really have a better idea of exactly what some of the existing resources are, I think is an important step.
Agree with you. I would love to go to one of those meetings if that's possible, just to hear and get a better idea of what some of the thought processes are. So think of me when you go to the next meeting and invite me, and I'd love to go.
You'd be more than welcome. Yes, thank you.
Yeah.
Yes, I'm sure as you all start to identify gaps to the Alliance and the City of Worcester might have some ideas for us as well, depending upon what we find the needs are. So that's great. Thank you, Bill. Alliance team, did I miss anybody for updates? I don't think so. Okay, thank you. All right, 2 of our favorite things. Nancy will be very relieved once we get through this, but Nancy graciously sent over to members of the board some recommendations around the remaining fees that we wanted to look at. I'm gonna try and be concise as I go through. There's a few where, Nancy, you've made some recommendations that are kind of consistent across a couple of sections. And so after discussion, I just ask if any member of the board that makes a motion to, accept a certain fee, if there's a couple we can like put together in that section, this might help us move it along a little bit. I know this is a timely process. But with that, I will jump right in. And it looks like the first one is recreation camps, where we are currently at 150 for the year, and Nancy's recommending 200. Nancy, any comments to make on the recommendation here?
The actual review process is really quite extensive. So that was my reasoning for going up in the fee.
It's not completely off from where the others are town-wise. Bill or Nancy, Karen, any questions for Nancy or discussion?
No, this is Karen Wazeski. You have no questions. I know that these types from my historical years of doing this, in hearing about the in-depth process that needs to be done, I totally understand. So I'd like to make a motion that we increase the recreation camp fee from $150 to $200.
Is there a second?
This is Bill Muller. I second that.
Roll call.
Karen Wazeski Govan, aye.
Bill Muller, aye.
Jen Maynard, aye. Okay, housing certification inspections. Looks like we are at 50 and Nancy is recommending that we keep that at 50. Which seems to be reasonable, given I don't think there's necessarily a fee in other communities for that, but certainly, as Nancy has indicated, there is work that goes into these things for her and the team. Nancy, anything to add?
No, we never had a fee for that. We just implemented that not too long ago, actually.
Oh.
That's why I'm thinking maybe to keep it at 50.
That's reasonable. Members of the board?
Do we have to vote on keeping it there or just pass over it?
Yeah.
What do you think, Nancy? Do we need to?
Vote.
What's that? Vote?
You need to vote.
Yeah, that's what we
Please.
thought. Yeah.
This is Bill Muller. I propose that we keep the $50 charge for housing certification inspections.
This is Karen Gustowski Govan. I second that motion.
Paul?
Bill Muller, aye.
Karen Gustowski Govan, aye.
Jen Maynard, I forgot about me, sorry. Yeah, I was thinking about bulking some of the keeps together, but they're kind of all over the place for the stuff, but we'll be able to bulk some of them together, I promise. Beaver permits. It looks like we were at 25. Nancy's recommending we go to 50, which is pretty consistent with the other communities around us. Anything to add, Nancy?
No, that was the reasoning, the other communities.
What is a beaver permit? Is it to?
Yeah. I'm glad you asked because
what does one do with a beaver permit?
They call a beaver deceiver, I believe it's called. And you can have them trapped.
Oh,
There are people out there that do this.
Gotcha.
Yep.
We'll call it relocation.
Yeah, got it. Okay, that makes sense.
Yeah.
Good to know.
It's rare that you hear of one coming through. Trust me, I probably on one hand can count for the
I don't know. I live on the river, so
15 plus years of being on the board. I'm trying to think of the last time I remember hearing about a beaver permit.
I'll call Nancy if I need to know. You can take the beavers if I need them.
Not many.
Okay. Any questions from the board or motions?
This is Bill Muller. I move that we increase the beaver permit fee to $50.
This is Karen Gwiazdowski Govin. I second that motion.
Roll call.
Bill Muller, aye.
Karen Gwiazdowski Govin, aye.
Jen Maynard, aye. All right, and recommendation to keep the Grafton septage permits at $10 each.
That is something that each septage hauler needs to purchase to dump at the Grafton treatment plant. So they're the ones that kind of keep the fees going. They don't really think that we need to increase.
Members of the
But
board?
it's a fee. That's why it's on here.
Yeah.
Yep.
This is Bill Muller. I propose that we keep that Grafton seepage permit fee at $10.
Karen Gwiazdowski Govin, I second the motion.
You're muted.
Hear me?
Yep, now we can.
I'm
There you
sorry. Getting tired. Not me. Computer. Must be the computer. Roll call.
Bill Muller, aye.
Karen Gwiazdowski Govin, aye.
Jen Maynard, aye. Okay. Perk residential testing. And this has 4 different categories. 3 with increases and 1 to keep. So it looks like, I don't know, Nancy, so one was from 325 for a lot to 400, which is pretty consistent with
Right.
other communities. That's a residential, and then the commercial being 425, which is currently 0, but 425 is consistent with other communities and also brings it just above residential. And then there's a test for the whole on the same day from 50 to 75, and then a separate day 75 to keep. Nancy, anything to add besides the communities piece?
No, on the commercial, we've never had commercial before.
Mm.
So that's just an addition that we're putting in there. In addition, the commercial section. The increase is keeping in line with the other Alliance communities. Plus, there's a lot of work when there's soil testing,
Sure.
not just going out and inspecting, witnessing, but a lot of paperwork involved in that too.
And it seems reasonable that the commercial rate, even though we're adding it, would be higher than the residential rate. Members of the board?
Can we vote on all 4 at the same time?
You'd have to, we could, but you have to just state each one.
Yes.
specifically. Yep.
I'll try to do that.
Okay, take it away.
This is Bill Muller. I propose making the perk test residential fee $400. The perk test commercial fee $425 with an additional whole charge for the same day at $75 and keeping the charge at $75 for additional whole a separate day.
This is Karen Gwiazdowski Govin. I second that motion for all 4 of those fees that Dr. Muller listed out.
Roll call.
Bill Muller, aye. Aye.
Karen Gwiazdowski Govin, aye to all 4.
Jen Maynard, aye to all 4. Oh my goodness. All right. Title V inspection report review. Oh, Devon, this is for you. Let's see. We have nothing right now. Nancy's proposing $50. It's kind of a mix across the communities. Nancy, anything to add?
That's the new category.
Oh, New category.
Right. When you sell your house, you're on a septic system, you have a Title V inspection review. And a lot of the towns, not even just the Alliance, they charge for it, and we never have.
Mm-hmm. That makes sense.
So you've got to do the review and then follow up if it's a fail or a component that needs repaired. Just follow up with it.
Makes sense. Members of the board? Discussion or motion?
This is Bill Muller. I propose we institute a fee of $50 for a Title V inspection report review.
This is Karen Guzowski-Govin. I second that motion.
Roll call.
Bill Muller, aye.
Karen Guzowski-Govin, aye.
Jen Maynard, aye. Okay, Nancy, what is DSCP?
Oh, I'm sorry. Disposal System Construction Permit.
There we go. I thought it had something to do with that, but just for the record, that's what we're reviewing next. And there are 1, 2, 3, 4, 5 separate fees associated with this at different things. Similar to the perk testing, there's one for a residential plan review, which is currently at 300, and it looks like there's a proposal for 350/400.
Correct.
So that's for the initial and then the ongoing inspection? 2 separate fees?
That's for the initial, correct, yes.
Okay, so 350 then the following.
Which includes the inspections. Yeah.
Okay, got it. And then the commercial plan would be a 400.
We never had commercial on there, so I'm adding commercial.
Mhm. And then it looks like there's a third review from 75 to 100,
Mm-hmm.
and abandonment from 25 to 75, which is very on par with other communities. And a D-box tank pipeline, which is currently at 75 with a proposal for 100 and 125.
Or
Or,
either 100 or 125.
oh, so you want us to pick between 350 and 400 and 100 and 125 on these?
I'm sorry?
So there's,
Yes,
yeah, gotcha, okay.
yes, I think so.
Okay, all right, so let's go back up to the residential. If we're good with 400 for commercial, like we did above, we probably should do a little bit lower for a residential, I would think.
350 for that.
And then, so looking at this D-box tank pipeline line item, we're at 75, other communities are at ranging from 125 to 225. So we're pretty low. We can either just inch up by 100 or go up to the 125. Do you have any idea about the lift and the volume of these for you guys, Nance?
We see a lot of these. A lot of component inspections. It's not just a permit, it's an actual inspection that you've got to go out and do.
Oh, gotcha. Do you have a
Yeah.
preference or a leaning towards a recommendation of the 100 or the 125?
Either or. Yeah.
Let's say 125.
Physical inspection include in
Yeah.
the report. I think that makes sense. Members of the board, any other questions, discussion, or motion?
This is Bill Muller. I move that we modify the DSCP residential plan review, including inspection, to $350. The DSCP commercial plan review, including inspection to $400. The DSCP third review and thereafter to $100. The DSCP abandonment to $75, and the DSCP D-box tank pipe line inspection to $125.
This is Karen Gwiazdowski Govin. I second that motion for all 5 of those fee updates.
Roll call?
This is Bill Muller, I, and I.
This is Karen Gwiazdowski Govin, aye to all 5.
Jen Maynard, aye to all 5. Thank you. All right, almost there. 1, 2, 3, 4, 5. This one's a little straightforward as well. This is all well permit. As expected, there's a well permit, residential and commercial, and I'm going to assume that we didn't have a commercial before because it was at 0. And like our earlier conversations, the recommendation is to increase the residential from 100 to 150 and institute a commercial permit at 200, which is again above the residential. And then looking at the well abandonment fee from 25 to 50, which will bring us more in line with several other communities. Well geothermal from 25 to 50, and well monitoring from 25 to 50. Nancy, any comments?
The residential is basically keeping in line, and the commercial is, it's new. We've never had it, so it's a new one.
Yep. Members of the board, any discussion or motions?
This is Bill Muller. I'll move that we modify the well permit for residential properties to $150, for commercial properties to $200, and the well abandonment to $50, with geothermal wells to $50 and well monitoring to $50.
This is Karen Gwiazdowski Govin. I second the motion for all 5 fees that Bill listed.
Roll call?
This is Bill Muller. I.
Karen Gwiazdowski Govin, aye to all 5.
Jen Maynard, aye to all 5. 2 more, almost there. Okay, portable toilets. I'm assuming permit for them. Right now it's at $10 per toilet. Recommendation is to increase to 25. Nancy, any comments?
No.
Members of the board, any questions, discussion, motions?
This is Bill Muller. I propose that we modify the fee for portable toilets to $25.
This is Karen Gwiazdowski Govin. I second that motion.
Roll call?
Bill Muller, aye.
Karen Gwiazdowski Govin, aye.
Okay, last one. Jen Maynard, aye. Last one on this vote. And then the last one, late fee non-compliance. All applications, we currently have a fee of 100. That's pretty on par with other communities. Some double their fees, which, I think Nancy's proposing reasonably to keep at the $100 late fee.
This is basically trying to get a separate line item in there, because I had someone call me on a late fee for a tobacco permit, and it was only listed under food. So we want to make sure that it's called for all applications.
That makes sense. Make it clear for everyone. Members of the board, any discussion or motions?
This is Bill Muller. I move that we make our late fee for non-compliance. We'll keep it at $100.
Karen Gwiazdowski Govin, I second that motion.
Paul?
Bill Muller, aye.
Karen Gwiazdowski Govin, aye.
Jen Maynard, aye. Nancy, thank you so much for your work on, well, always your work on these applications and permits, but for your recommendations, I think that helped us move things along much more smoothly. So much appreciated.
Jen, can you go back to the very top, daycare?
Daycare. Oh, did I miss?
It's in red.
Yes, daycare, thank you. It's in-
So at the very first meeting, you voted to no charge because they only do like, I don't know, boiled water, goldfish, things like that.
Mhm.
But we still have to process the paperwork, and Devon still does an inspection. So I'm proposing we do charge either 25 or 50.
Was this the conversation we had about the schools in general, or was this something else?
It was included, but the schools we don't charge because you're charging Grafton to pay for Grafton.
Right. Then daycare.
Right. And these are just private daycare.
Got it. Members of the board, any discussion on that? And should get a recommendation of either 25 or 50.
This is Bill Muller. I propose we make the permit charge for daycare $25.
This is Karen Guzowski, and I second that motion.
Roll call.
Bill Muller, aye.
Karen Guzowski, and I.
Jen Maynard, aye. Thank you, Nancy. All the red.
Now, when do you want these effective? February 1st?
Sure.
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 Or retroactive, because some of these we've already issued permits for. I don't think I can go retroactive. I don't think people will like it.
No, should we do February 1st? Do you need us to make
So what's today?
that?
The 6th.
Yeah.
Today's already the 6th.
All right.
To make it as of tomorrow.
I've got to get it all sorted out and let the people know. I'm all alone in the office. I have a meeting tomorrow with finance. I don't think I can do tomorrow, Bill.
And we'll make it February 1st.
Well, no, I mean, I can do January, just not tomorrow.
Well, I think February 1st seems reasonable to be able to get messaging and things out. So that way you're not feeling rushed.
You make it the 21st, which is the day after Martin Luther King Day.
You could if you want. Which works better for you, Nancy? Your finance meeting should go well. How about we do, let's see. I think we should just do February 1st. That gives her the rest of the month to message folks and get everything set up.
Okay.
Do you need a motion for that or a vote on that?
Yes, please.
This is Bill Muller. I move that we make these modifications in our charge structure effective February 1st, 2025.
Karen Guzowski, and I second that motion.
Roll call.
Bill Muller, aye.
Karen Guzowski, and I.
Jen Maynard, aye. Okay, and then we had 3 sets of minutes that Nancy graciously sent to us. I think Nancy's gonna resend around the October 7th minutes. We made a few edits just for the board's consideration. And then, so we'll bump that one to the next meeting. That's all right. And then, any discussion on the November 18th minutes? Any motions?
This is Bill Muller. I move that we accept the minutes of the Board of Health meeting on November 18th, 2024.
Karen Gustowski Govan, I second that motion.
Roll call.
Bill Muller, aye.
Karen Gustowski Govan, aye.
Shortest meeting of the year, if I recall correctly. Anyone? Any motions or discussion?
You accept the motion to adjourn the meeting?
No, I still need a motion for December 16th. For December 16th meeting minutes, any motion to accept?
Let me see. I guess I don't have that one printed out.
Oh, okay.
Um,
Do we want to hold off on that one?
I can make a motion. This is Karen Gustowski Govan, to make a motion that we accept the December 16th, 2024 minutes as written.
It's Bill Muller, I second that motion.
Roll call.
Karen Gustowski Govan, aye.
Bill Muller, aye.
Jen Maynard, aye. Okay. Anything else? Old business? Nothing that I can think of? Anything new to report? Reported all the things. Nancy, you just did wonders for the fee stuff because that's the fastest fee review meeting we've had and probably one of my fastest meetings since I started running them for you all. How about, Bill, I know you're loving all these motions tonight. Would you like to make the final motion of the night?
It's Bill Muller, I move that we adjourn this meeting.
Karen
Oh,
Gustowski
excuse me,
Govan,
Jen,
aye.
don't text that yet.
Oh,
Not yet. What about the upcoming meetings? I'm sorry.
upcoming meetings, February 3rd, 2025, remote. March 3rd, 2025, remote. And so far, we do have April 7th, 2025, May 5th, 2025, and June 2nd, 2025 listed to be in person, as we do not yet have any order to continue remote meeting provisions at this time that I'm aware of. If that changes, then we may modify that, but I think our meeting schedule is good for through June.
And just a reminder, there's only 4 of you right now.
Right. So there might be for folks that may listen to this, if you happen to notice that we modify the meeting schedule, we must have a quorum for vote. So if we have board members that schedule has changed to what we've agreed upon here, we might need to make modifications, but there will be public notice noted for that. Nancy always keeping us to task over here. We'll try it again. Bill.
This is Bill Muller, I want to reclaim my motion of wanting to adjourn this meeting.
Karen Gustowski Govan, I second that motion.
Roll call.
Bill Muller, aye.
Karen Gustowski Govan, aye.
Jen Maynard, aye. Very good. Happy Monday. Happy New Year. Thank you all for joining.